What if somebody has been wearing a denture like 10, 20 years, where they have really bad teeth, and they've been told they don't have enough bone? You say that you work with people with limited bone. Tell me about that.
So nowadays, some dentists back then say, "Oh, there's no bone, there's nothing we can do." But technology's allowed us to grow bone now, so we can grow bone in multiple directions. And if you have absolutely no bone, we can do implants in your zygoma, which is up here, for people who have absolutely no bone. So the people with really limited bone, we have special implants that are much longer and much stronger to compensate for people that don't have bone.
Okay. And so these bone grafting procedures, though, not painful?
No,
for the most part?
If you can withstand an extraction, then this is probably a lot easier, actually.
Now, tell me about your training, because you've got, I guess, all over the country learning implant dentistry.
Well, funny thing is, in dental school, they actually don't really teach you dental implants. So when I got out, I got to go travel all around the country to learn from the greatest implant surgeons out there. So that way I can learn how to do great work on my patient.
Is there that much to it?
After you went through training, there's that much to it.
I mean, you've done hundreds and hundreds of hours of implant training, is that correct?
Yes.
And is there a big learning curve in this?
After the first couple hundred hours, it gets easier.
Okay.
It's like kind of like when you're first riding a bike, the first time it's kind of hard, but then after you ride the bike, it's super easy, right? So the first implant that you do is kind of super hard.
So you've done hundreds and hundreds of implants.
Probably thousands now, actually.
I mean, is that a fair question? Ask your dentist, how many implants have you done?
Yeah.
But they don't ask that usually, right?
Most people don't. They
feel like it's a rude question.
Yeah, but it's not a rude question. You probably want someone who's doing thousands of implants, because if it's only like hundreds, it's not very many.